So when we're doing a CBC, when you're drawing blood right here, keep in mind, here's a picture of what blood is supposed, a representation, a diagram, right? Notice that you have red blood cells here. They're red, obviously, but if you take a look at them, they look different, right? They look like what they call biconcave disc. They look like little donuts. And what we're gonna see in terms of red blood cells is simple. Red blood cells are there to carry oxygen and carry carbon dioxide at times. That's its main purpose. So what we're gonna see is the whole internal aspect of a red blood cell is meant for that purpose. It doesn't need space for a nucleus. It doesn't require space for any of the normal organelles that we see in a typical cell. So in the typical cell, you see a nucleus. You see rough endoplasmic reticulum, smooth, all these other organelles. You see mitochondria. Well, that's not true with red blood cells. Again, the main purpose is just to carry oxygen. We don't want it to have to use the oxygen it's carrying. If it does, it can steal it from the actual organs it's supposed to take that oxygen to. So that's what we don't want. We don't want that oxygen carried by the red blood cells to be used by the red blood cells. We just want it to carry it to the purpose, to the muscles, to the tissues that require oxygen. Because of that, even the mitochondria that we see in a typical cell is absent from a red blood cell. So these red blood cells are completely different in terms of what they appear, how they appear, and the actual internal aspects are completely different as well. Now, some of the numbers that we're going to talk about are going to be incredibly large. When we talk about how many red blood cells do we produce per minute, how many we produce per day. So yeah, it doesn't matter that it doesn't have a nucleus. It doesn't matter that it doesn't have a mitochondria or rough endoplasmic reticulum or smooth endoplasmic reticulum. The reason why is because when they get damaged, we have 2 million being reproduced every second. So if this red blood cell is worn out, we don't care if it can't heal and repair. We have 2 million just like it, ready to go every second. So in terms of blood, keep in mind when we talk about blood, there's whole blood, and this is whole blood that we see here, right? But, right, when we take blood out of your arm, let me ask you this. Are we taking blood from a vein, an artery, right? Which one? Is it from a vein or an artery? You don't have to answer, except on the chat. So if you have the chat right here, make sure you kind of try to answer it. Where's my chat? Right? When we take blood out, is it from an artery or vein? Simple question.
Vein.
It's vein.
50-50. Right? You guys have all gotten blood draw. Is it from an artery or vein?
Vein.
Vein.
Right? So, right, most people, even though I wrote vein, it should be vein, sorry. Right? No, almost all the time we get a blood draw is from a vein. The only time we get a blood draw from an artery when we think there's something wrong with oxygenation. Then we'll do an arterial blood gas, an ABG. Now, usually phlebotomists will not be allowed to do an ABG, right? The big difference between why we do an ABG or why when we get blood from an artery versus a vein is very big reason why we don't tap an artery very often, right? Arteries are pressurized. So if you tap an artery, you will have pressure that will then cause that bleeding to occur, all right, until clots settle. In other words, you'll keep bleeding and bleeding and bleeding until you have something that will stop that clot, right? Or stop and prevent that, loss of blood by forming a big clot. Well, in a vein, veins are very low pressure systems. So it's much easier to form clots and to seal that hole that you have just produced in a vein. In an artery, it takes a while. Not only do you have lots of chance of hemorrhaging, but arteries have lots of smooth muscles, which has lots of nerve receptors. So you will feel a lot of pain when we do an ABG. I remember doing an ABG on this woman, right? And this woman, when I was in medical school, we had to go through training at Mount Sinai in Chicago. It's on Ogden in California. It's in the middle of a really bad area of Chicago, right? And when we did this I've had to do an ABG on this woman that we think had sarcoidosis. Tough woman, right? And what happened is she knew she's had sarcoidosis, right, before, or they're trying to make sure it is. And she's had an ABG that somebody messed up before. She didn't even want me to touch her arm until I numb it up, right? That's how bad it hurt, she said. And she, obviously eventually it's really hard to numb an artery because it's so deep. So we just had to go in there, right? And I'm lucky because I was able to get it right away. Then, right, it still hurt. And with veins, it might hurt a little bit. But with arteries, when you're trying to tap it, it hurts for a prolonged period of time. Most people do not choose to do an ABG. Now, when we're looking at whole blood, we're taking blood from a vein. That blood is whole blood. And what do we see in terms of function of blood, right? The function obviously includes a transport of all of our gases, nutrients, and waste. We'll talk about the nutrients and waste in a second. Transport of processed molecules like vitamin D. We all know that our body makes vitamin D, but it makes a precursor of the vitamin D. We also know that sunlight is good for us, right? Sunlight starts the activation of vitamin D, but it has to then go to the liver and then to the kidneys to fully activate. But how do we move that vitamin D around so then we can get it to activate? Well, it's found as part of blood. Transport regulatory molecules, hormones are transported to the bloodstream. Regulation of pH and osmosis. Our normal blood pH is slightly basic. It's not 7.0 and neutral. It's slightly basic. We're going to see that's important later on, right? Why we need this slightly basic blood and how we make slightly basic blood we'll discuss in a lot more detail in chapter 22, as well as let's talk about it later on this semester when we talk about the kidneys. Maintenance of body temperature, shivering. You guys went through chapter 5 when we talk about the skin. We know when you contract the muscle, you create heat as a response, as well as the movement of the bone. Now, when you have probably heard, and most of you have heard of this saying, right? It's a saying your mom, even your coaches probably told you when you're playing sports in high school. When you are shivering, your body is already hypothermic, meaning that because I see you shiver, your body temperature is already super low. That's true. When your body shivers, shivering is an uncontrolled muscle contraction. I just said muscle contraction creates heat, right? But usually you cause a wanted movement, and the heat is just a side effect. Shivering causes us to move with no real purpose except to create body heat. In other words, you're shivering to create body heat, and that's it. That's very inefficient. And what happens then? Well, your body hates to waste energy. If it's wasting energy and causing an uncontrolled muscle contraction, shivering, that means that it's very inefficient at that point. It only does that when your body temperature is already low, right? So blood plays a big role in causing our body temperature to increase in a certain area or decrease. Protection. We've talked about antibodies. You've heard probably of antibodies in the last year, right? Isn't it crazy to think 10 months ago, everybody was in class, everybody had their kids in school, nobody was wearing a mask, right? And this whole thing has happened in such a fast time frame where everything changes. Well, what happens with COVID is our body has not had time to produce antibodies in sizable amount. We'll talk about in chapter 23 that the crazy thing is this, our body can't produce antibodies. They will produce antibodies to COVID, right? To coronavirus. This coronavirus, even though it's never seen in the world before, this specific type of coronavirus, it doesn't matter. Our body will produce antibodies to it, no matter what. 99% of the people that have it, right, they survive. Why? It's because we have an inherent ability to fight off infections. The older we get though, the less ability to fight out those infections. So those antibodies are incredibly important. Some of you might have heard of monoclonal antibodies, that remdesivir. Well, those are antibodies. Supposedly they attach to the coronavirus, preventing the coronavirus from then entering the cells. Now, it doesn't have to be corona. We do give, right? Some of you might have heard of rabies. With rabies virus, when you have been given that kind of, if you've gotten a bat bite and you go right to the emergency room. By the way, guys, if you've gotten a bat bite, you have to go to emergency room because there's a chance that that bat has rabies. They're the most common vectors of rabies in America. Well, they give you numerous shots, right? So they assume you might have been exposed to rabies, and now they give you shots, right? The shots, people freak out because you need a lot of them. Well, those shots are antibodies to the rabies virus. Hopefully, by introducing those antibodies, then the antibodies attach to the rabies virus before the rabies virus has penetrated into the brain. And we'll talk about rabies, and I love talking about, immune system because it's so cool to see how our body fights off things that it's never seen before, right? Clot formation is the last part of the function of blood. Now, when we take that blood, this is whole blood that we've removed from your body right here. Most of you have gotten a blood draw before. Now, if you've gotten a blood draw, next time you get a blood draw, I want you to take a look. Look to see if the bottom of the test tube has a thick film of some kind of gel on the inside, right? If you're in an actual lab, let's say you go see your doctor, the doctor goes and tells you that you might need some blood drawn, and you take 10 steps and you go right into their lab. Well, usually, because it's in the lab right away, what they'll do is you might not see that film because they're able to run your blood immediately. But if you're in a hospital, if you're in the ER, anytime they take blood, there's always this thin film of a gel on the bottom of the test tube. Look for that next time you get a blood draw, right? And we'll talk about in a second why that thin film is there. In other words, the test tube usually isn't empty. There's something on the very bottom. Now, when we take blood, we draw it out. That's whole blood. You have about 10, 15 seconds before it completely clots. So what we're gonna need to do is spin the blood, right? We put it into a centrifuge. The centrifuge takes that whole blood and separates it into the liquid portion and the elements portion, the formed elements. These include your cells, red blood cells, white blood cells, platelets, right? These formed elements are also known as your hematocrit, right? So hematocrit counts. When you're doing blood draw, they will tell you what your hemoglobin count is, what your hematocrit count is, right? Normally 45, 47% in males. In females, it can be a little bit lower, 43, 45%, right? But basically the formed elements, when you take a look at it, take a look at these numbers. Red blood cells, 4.5 to 6 million. That's a huge number. White blood cells, 5 to 10,000 only. Platelets, 250 to 400,000. All of these make up our formed elements. Because these are whole cells with proteins, they're heavier. And when we spin it, they fall to the bottom, right? Now, how about the part on top? That part on top is a liquid portion. The liquid portion is called plasma. When somebody does their blood sugar count, when they're measuring the blood sugar count, where are they finding the sugar, right? The glucose will not be found in this formed element part. That's only cells that are heavier. It's a plasma. We don't think plasma is important, but when people are in surgery and they're bleeding during surgery, we can give them red blood cells or we can give them plasma. Why do we give them plasma? Plasma contains lots and lots of nutrients, lots and lots of ions, right? So those nutrients include glucose, include sodium and potassium. So when we say somebody has a high sodium count, when we're doing a BMP, basic metabolic panel, we're measuring the plasma. So a CBC, we're measuring the formed elements. CBC is a complete blood count. That tells you how many red blood cells we have. Tells you how many white blood cells we have. Tells you how many platelets we have. Now, if we do a CBC, that's this part right here. When we do a basic metabolic panel, some places call it a Chem 20, right? They're looking at the plasma and checking what kind of ions are in the plasma. What is the amount of proteins in the plasma, right? Now, most of it is water, but the other 9% that's not water are incredibly important. The ions, sodium, potassium, right? Calcium. Well, when we measure calcium and we know that you have low calcium, well, that's found in the plasma, right? Not in the formed elements. So know the difference between these two, right? This is the difference in why when you are doing your rotations, right, and you're going through surgery rotation as an RN, you hear the anesthesiologist. That's what I trained as. You hear the anesthesiologist telling the surgeon that I'm giving him, right, 2 liters of plasma, or not liters, all right, a bag of plasma, right? That's why we give the plasma, because that's where all the nutrients are. Albumins, globulins, fibrinogen are all part of the proteins found in plasma. This is the big one right here, albumins, right? And albumins play a big role in osmotic differences in our body. If albumin levels are low, it's a sign that you have some kind of liver failure. Other solutes, ions, including sodium, potassium, calcium. Those are main ones, including as well bicarbonate. Nutrients, glucose, right? Amino acids are found in our plasma, and it allows us to bring nutrients to the tissues of our body. Waste, because I've heard of urea before, right? Urea is a waste product when we use amino acids as a fuel source, right? And I'll show you that later on. So waste, even though, you know, we don't think of our body having waste, the main waste we have in our body are accumulated waste called urea and uric acid, nitrogenous waste. And then some gases are going to be carried, not attached to hemoglobin, found on red blood cells, but these gases are going to be dissolved into the plasma. That's how we carry some carbon dioxide, right? About 20% is going to be, not, let me rephrase it, about 9-10% will be carried as a dissolved gas. And if you're thinking about how do we have dissolved gas, carbon dioxide, in fluid, plasma? Well, every time we drink a soda, that's a dissolved gas in fluid, right? Regulatory substances like hormones are also found in the plasma. So when we talk about formed elements, that's everything except these guys, right? Which is just cells, that's it. Everything else besides cells is found in the plasma. So again, review these in terms of the albumins, the ions, and we'll talk some about these right now. Plasma is a colloid, right? A colloid is a liquid containing suspended substances that doesn't settle out of solution. So when I highlight something, I want you guys to know what it is, right? So what is a colloid, right? A colloid is like milk. Now, milk should not need to be shaken every time you're about to drink it, right? Milk is a colloid, meaning that even when it sits at rest in a refrigerator, right? When it sits at rest, the proteins doesn't fall to the bottom. The glucose and the galactose doesn't fall to the bottom. It just stays settled out. There's no reason to ever have to shake milk. I've seen people do that, but all right, because milk is a colloid, you shouldn't ever shake it. Now, oppose that to something like freshly squeezed orange juice. With freshly squeezed orange juice, what happens? Well, if you let it sit for a while, all the pulp goes to the bottom, right? That's different than a colloid. Colloid should never have to be mixed. Our plasma right here, right, is a colloid where that fluid, the plasma part right here, has all of the sodium, potassium, all of those ions, all the proteins, and they are basically, right, kind of not allowed. They're suspended in that fluid, and there's no need to ever, you know, have it mixed up. Now, the albumins are a big one right here. I'm going to highlight this so you can tell and discuss it and read about it. Now, albumins, important for what? For blood viscosity, right? We're going to see, in terms of last semester, you should know what osmosis is. Osmosis, just a quick review, is the movement of water, right? Now, osmosis is a movement of water due to concentration differences, right? Concentration of solutes. Let's say in my blood vessel, right? Blood is going to be brought through to our target tissue by way of small blood vessels called capillaries. So what happens is this whole blood with lots of plasma goes through our capillaries as it goes through the tissue we're trying to give oxygen to and nutrients to. Albumins are found inside our blood vessel, in our capillary. Why is that important? It provides an osmotic pressure, right? If we didn't have albumins and blood is going towards that tissue, the tissue has fluid surrounding it. Well, what happens then? Well, we didn't have albumins, right? Water from the surrounding tissue, right?
Yeah.
And water as plasma in our blood, well, we're going to start seeing a little bit of water movement. If we don't have albumins, our concentration of solutes in our bloodstream is very low, right? It's going to be much higher in the fluid that we're going to bring nutrients to, our interstitial fluid. What happens then? It's so low because we don't have albumins, water leaks out into our tissue. As water leaks out into our tissue, it creates edema, right? This is why, if you've ever seen people that are alcoholics, alcoholism affects your liver first, which then causes these albumins to be stopped. They're no longer produced because the liver is damaged and albumins are formed in the liver. The low albumin count means that, right, there's no more osmotic pressure keeping water in the plasma. Water wants to leak out of your bloodstream and go into the surrounding tissue. Now, most of you guys have seen people that are alcoholics and they have severely distended abdomens, right? The beer gut, right? Well, that distended abdomen is caused by the lack of albumins. We call that situation not a beer gut, we call it ascites. And it's due to water movement from blood vessels in the abdomen. Water moves out of the bloodstream into that surrounding tissue, causing that tissue to become edematous, right? So albumins are incredibly important for that. What else do we find in plasma? Ions, sodium, potassium, right? So just write that part down, right? Primarily the big ones. The most important ones are the ones that can create issues. Sodium, potassium, calcium, all are incredibly important. All can cause a lot of dramatic issues if there's an imbalance. Now, the big one being potassium, right? Imbalance in sodium can cause us to have, right, issues in terms of edema. Imbalance in potassium can cause us to die. So that's not good, right? So right here, sodium, potassium, and calcium are the big ones, right? Other ones include bicarbonate. We'll see some phosphorus here as well, but, right, bicarbonate is important, but even then it doesn't create as much issue as imbalances in potassium or calcium. Now, usually ions there are involved in the osmosis as well, right? By providing us a constant, right? By creating, sorry, trying to make this normal, right? Some kind of osmolar force. Remember, albumins are important, so are all of these ions. Keep in mind with osmosis, water wants to move from an area of low solute concentration to an area of higher solute concentration, right? And there needs to be a membrane in the way for osmosis to occur. You need a semi-permeable membrane. In our body, in our cardiovascular system, that membrane is produced by our cells are capillary cells producing blood vessel, right? Water is going to want to go from the interstitial fluid space to your plasma, from your plasma out towards your interstitial fluid space. To prevent water movement, we need an equilibrium. And that's what we normally see, right? In our plasma, all of the solutes combined, all of the sodium, potassium, glucose, right? Bicarbonate, all of the urea, all of the uric acid, all of the amino acids, all of the albumins, all of the solutes combined creates an equilibrium of 300 milligrams per deciliter blood. So that's the amount of solutes found inside our blood vessel, 300. Then if you're on the outside, it should also be 300. If we are both have at very similar solute concentrations, water doesn't move. Perfect, right? But if there's an imbalance, let's say you have a very high sodium diet. If you have a very high sodium diet, I have more sodium in my plasma. Makes my solute concentration in plasma higher. So now I have higher solute in plasma and relatively low solute in my interstitial fluid space. Water is going to go from your fluid space to your plasma, increasing the water balance in plasma, increasing the pressure required to push that whole blood. What happens then? You have high blood pressure as a response, right? So one of the reasons we tell people to either slow down their sodium ingestion or try to completely stop their sodium ingestion is so that we can lower their blood pressure without giving medications. Now, what else is found in plasma? Mention it as nutrients, glucose, amino acids, fats, triacylglycerol or triglycerides, right? Even vitamins, those are all found in plasma. And waste products include urea, right? Uric acid, creatinine, ammonia salts, bilirubin, lactic acid. These are all waste products that our body produces. Lactic acid, you guys have heard of, that's what happens to, right? If you remember a little bit of biochem, right? Lactic acid is produced when you are undergoing extreme exercise and your body can't cope with it. So it produces lactic acid because you can't get enough oxygen into your system. All right, so these are the actual, there's a good picture just for the table to see which is found where, what are the plasma proteins, what are globulins, right? And these are all found as composites of plasma. Now, besides the plasma, we have these formed elements. Red blood cells, our biconcave disc contains hemoglobin. 2 million red blood cells are produced every second. And the big one is this, right? You can produce 2 million red blood cells, but there are no organelles. Because there are no organelles, there's no way for that red blood cell to be repaired and healed, right? So the main purpose is to transport oxygen and carbon dioxide and, right, to ensure that they don't use the oxygen they're carrying. There are no mitochondria. There's no nucleus. The sole purpose is to clear out everything in the cytoplasm and get as much hemoglobin in as possible. So then we can carry as many oxygen molecules as possible. Remember, oxygen is fuel. The more oxygen we bring into our bodies, the more and the longer we can exercise. Oxygen is our main fuel along with glucose. When we have a lot of oxygen, when we have a lot of glucose in our bloodstream, we have a lot of fuel for the muscles to use. Now, besides red blood cells, we see white blood cells. White blood cells, and these terms are going to be very, right? They're going to sound very similar, right? Leukocytes and lymphocytes, but there is a difference. Leukocytes means all white blood cells. Those are leukocytes, right? When we look at the white blood cells, they're then going to be divided into granulocytes, granulocytes and agranulocytes. So the granulocytes are going to have what looks like little tiny dots inside the cells, right? Those dots are called granules. And within those dots, we'll see, right, the granules, we're gonna have different type of enzymes there. Again, these are white blood cells. They're there, hopefully, to kill all microbes that have gotten into our body, or, God forbid, any virally infected cell, they'll hopefully kill as well. So in order to kill it, it's going to release enzymes that will start puncturing holes into the microbe. So these granules are incredibly important. There are 3 distinct types: neutrophils, eosinophils, and basophils. And you need to know which one is for what, and we'll talk about that in a second. Agranulocytes, right? 2 distinct types. They do not have granules, so their cytoplasm should look pretty clear, in other words. All right, 2 main types of agranulocytes are lymphocytes and are monocytes. Lymphocytes are T cells, are B cells. We're gonna see all of these cells right here. These are what allows us to have immune memory. When we're getting the coronavirus vaccine, we're trying to activate B cells so then we can have memory cells that if we get exposed to the real coronavirus, we already have B cells in reserve, ready to go. Those B cells then explode in number so they can produce lots of antibodies to protect us from the real coronavirus, right? So lymphocytes are what allows us to have long-term immune memory. These guys right here are really good for the acute phase of an infection. They kill that virus immediately, but then they die off immediately as well. They don't give us immune memory. It are these cells and the monocytes that does, right? And in chapter 23, we'll go into a lot more detail about these. Platelets are cell fragments. They form platelet plugs. They release chemical factors, and they activate chemical factors necessary for blood clotting to occur. We'll talk about platelets at the end of this chapter as well. All right, so let's take a look at this picture. You see lots of red blood cells. Because there are no organelles, the middle of these, right, red blood cells look very light in color. There are no organelles. There's absolutely no nucleus. So you see these red blood cells everywhere. There's a 100-to-1 ratio between red blood cells to any white blood cells. So this is a granulocyte. Granulocytes, if you take a look, it looks kind of cloudy in the cytoplasm. Not only that, this is the nucleus. The shape of the nucleus looks very distinct. They look like little sausages, right? So we call the sausage-looking nucleus a lobed nucleus, right? We've seen like in a typical cell, the nucleus is nice and round and in the middle. Here, the nucleus isn't round. And not only that, the cytoplasm looks like they have little tiny dots all over it. Those are the granules. It makes these guys granulocytes. Now what else do we see? All these little specks of purple. These little specks of purple right here are platelets. And those platelets are not real cells. They are fragments of cells, and those fragmented cells are found in our bone marrow. So when we need more platelets because we're bleeding, what happens? Well, those huge cells in our bone marrow, they break off a little bit of itself and release it into the bloodstream. As they pinch off a little bit of itself, that little fragment it pinches off becomes these platelets that's released into the bloodstream. So these are all platelets, and these are not real cells. They're fragments of a larger cell, and that larger cell are called megakaryocytes, and they live in the bone marrow. Now, in terms of production, right, understand that production of blood cells is called hematopoiesis. And when we look at hematopoiesis, it all starts with a stem cell. Now this slide is better to explain it all, right? We have the pluripotent stem cell, meaning it can turn into any type of bone cell or any type of, right, blood cell as well. Now this pluripotent stem cell can turn into the myeloid stem cell line or the lymphoid stem cell line. Some of you might have heard of myeloid leukemia, right? Or lymphoid leukemia or lymphoblastic leukemia. So you can have leukemias or cancers in one of these stem cell lines, right? When you have a cancer in one, or God forbid, both of the stem cell line, usually nobody's that unlucky, right? If you have one of them that's cancerous, then everything that stem cell could become, everything is mutated, right? And you don't get protection from neutrophils, eosinophils, basophils, or even monocytes, right? With lymphoid stem cell line, if you have acute lymphoblastic leukemia, then all your lymphocytes are all mutated and non-functional, right? And you overproduce these. So if you've ever heard of, the leukemias, that's where we get the name, right? Myeloid versus lymphoid leukemias. Now, besides cancers, take a look. Myeloid stem cell line can turn into just about every cell, even a red blood cell, right? Even megakaryocytes that turn into platelets, and all of our granulocytes, and even our monocytes. These guys are going to be very important later on, all right, when we start talking about the immune system. So the main thing is probably the easiest way to understand which one comes from what is that lymphoid stem cell line turns into just lymphocytes. Even the root name, lymph, is the same. The myeloid, everything else. So if you need more red blood cells, we need this stem cell, right, to undergo mitosis. First is mitosis, right? As it undergoes mitosis, you form two daughter cells. One daughter cell stays a stem cell. The other one turns into the myeloid stem cell. That second one that turns into a myeloid stem cell then receives messages, right? Transcription factors that allows it to turn into red blood cells. Perfect. Take a look at these red blood cells, right? Very late on, in the development of the red blood cell, do we extrude the nucleus. Some of you might have heard of a reticulocyte count. Reticulocyte counts should be 1 to 2% of your red blood cell count. If it's greater than 1 or 2%, it's a sign that you have chronic anemia, right? You have anemia so bad that we're throwing out reticulocytes, releasing it, right? Not releasing mature red blood cells, but we're releasing immature reticulocytes, right? At that point, we're trying to get any red blood cells out as fast as possible. It's a sign that you have pretty severe chronic anemia as your reticulocyte levels increase. Now, take a look at the basophils, eosinophils, and neutrophils, and even the monocytes. They have lots of little dots right here. Those are granules that I was talking about. What else do we see, right? This is kind of like a video from our Connect, so make sure you kind of look at it, and I'll show you how to get to Connect in a second. All right, so red blood cells, found in higher concentration in males than in females, contains, in terms of components, 1/3 of the whole red blood cell is hemoglobin. Again, the sole purpose is to have as many hemoglobin molecules as possible, so then we can carry as much oxygen as possible. Right? The other 2/3 component are lipids, plasma membrane, stuff like that, ATP, enzymes, right? Carbonic anhydrase, enzyme that forms bicarbonate and carbonic acid. We're going to see, right? Red blood cells are going to carry carbon dioxide, and outside of it is going to have lots of water, right? That water, right? We're going to mix these two. In the process of mixing these two, we're going to form bicarbonate and carbonic acid. But that only happens right here. That only happens if we have that enzyme, carbonic anhydrase. All right? And we're going to see later on in a few chapters that most of the oxygen that will be carried will be in the form of this, right? So we seen like, you know, in probably when you guys were young in high school, right? They talk about how carbon dioxide is going to be picked up by the red blood cells and carried. In reality, about 20% of carbon dioxide we carry will be attached to hemoglobin. 70% of the carbon dioxide we exhale, well, that carbon dioxide will be in the form of this, right? This carbonic acid, right? And this is exactly, you will see this. This is the first time it's the first day. So we will see this reaction a lot, right? The same reaction. So I would, you know, ask that you memorize it, even though we won't get really into it until, and I probably won't ask the test on it until that first exam in a couple weeks, right? Again, carbon dioxide and water. Now, where do we see carbon dioxide and water? And keep in mind that when we undergo aerobic respiration, right? And I ask my classes in my normal in-person class, why do we die when we don't have oxygen? We all know we die if there's no oxygen, right? But why? Right? It's not an easy answer, to be honest. The reason why is simple. We die when we have no oxygen is because we can't produce enough ATP. Without oxygen, we will not produce ATPs to the extent we need to survive. Right? Now, if we do have enough oxygen, we do have enough glucose, we can produce lots of ATP in a mitochondria. But the byproduct is this too. Carbon dioxide and water are formed. This is the reason why we're always exhaling carbon dioxide. We're exhaling carbon dioxide because we produce so much of it through aerobic respiration. That carbon dioxide needs to be carried from your tissues that are actively producing it, so then we can exhale it. How do we get rid of that carbon dioxide, which is waste? Well, we add it with water, which is another byproduct of aerobic respiration. And when we turn it in something very useful, we turn it into carbonic acid, which then dissociates to bicarbonate. And what we're going to see is, right, the reason why our blood is slightly basic is because we have more of this guy right here, right, that base form of this, right, 20 times more of this versus this, the acid form, right? Because we have 20 times more base, makes sense that our blood is slightly basic, right? Oxygen transport, let me go through this, erythrocytes, and then we'll stop in a second. All right, so in terms of oxygen transport, oxygen is transported from the lungs to the tissues. About 99% of all oxygen is going to be carried attached to hemoglobin. By the way, that 99%, when you do a pulse ox, right? You put a little pulse oximeter onto your finger. They're measuring this 99% oxygen that's carried as part of hemoglobin, right? Now, the weird thing is this. I will tell you this, right? And then we'll come back to it later on. There is a way, right? Here's 98.5, and then 1.5% oxygen dissolved in plasma, right? That makes up 100%. Is there a way of going above 100%? Right? Can we somehow get above 100% if we need to? We can, right? We can only increase this amount attached to hemoglobin only to 99%. That's it, right? We can't force more oxygen to the hemoglobin. It's already full when we're at 99%. Can't carry anymore, right? It's all tapped out. So how can we possibly go above 100% then? This 1.5%, we can increase to 3 to 4%, right? How? By giving them really concentrated amount of oxygen, right? 100% oxygen at 4 atmospheres, 5 atmospheres, 6 atmospheres. By doing that, we can increase the amount of oxygen that's dissolved in plasma. What happens? Instead of this being 1.5%, if I put you in a hyperbaric oxygen chamber, I can increase it to 4 to 5%. 4 to 5% plus 99, now we're over 100% oxygenation. We can do it, and we sometimes do this, right? And we'll talk about conditions when that happens. Now, there's only, in other words, right, almost all of the oxygen is carried from your lungs to your tissues. Almost all of it is carried attached to hemoglobin and the billions of red blood cells we have in our body. Carbon dioxide is different, right? So in terms of oxygen, there are two ways to carry oxygen. One is the most efficient, where 99% of the time is being transported this way. That's when oxygen is carried by hemoglobin. And about 1 to 1.5% of the time is as a dissolved gas in plasma. Oxygen does not like being dissolved in plasma, right? It doesn't. That's why you never heard of an oxygenated drink, right? You've heard of a carbonated drink though, right? Well, why? We're gonna see that carbon dioxide more readily diffuses into liquid, right? It's just the nature of carbon dioxide. It's easier to push carbon dioxide into the liquid. Think of your soda, think of beer. That's carbon dioxide in liquid. Now, we can also do that in plasma, right? Now, obviously, when we bleed, right, you don't have like the carbon dioxide fizzing out when we bleed. It'd be very weird, very disturbing, right? So we do have some carbon dioxide being dissolved in plasma, but not enough to give you that fizzy, right, things that we normally see with and equate with carbonated sodas. But if you take a look, right, there's about 500% more carbonated gas dissolved in plasma than oxygenated gas dissolved in plasma. So 7% of the time, carbon dioxide is carried as a dissolved gas from our tissues, where we produce it, to where we release it in the lungs. 23% of the time, it combines with hemoglobin. So that's not a very large percentage, is it? Right? 70% of the time, we take the carbon dioxide produced as a waste product from aerobic respiration. We add it with another waste product, water. We combined it with an enzyme from our red blood cells, carbonic anhydrase. When we do it, we produce bicarbonate. This is what we produce. Right? In other words, we carry gases slightly different depending on the gas. Oxygen, 99% of the time, is attached to hemoglobin. It goes from your lungs to our tissues. Then the oxygen is removed from the hemoglobin, pushed out. As it gets pushed out, it goes through the interstitial space and then into the tissue itself. There's always a little bit of fluid, right? You guys have gotten a scrape before. If you got a scrape, you might not bleed, right? The scrape might not be deep enough to cut into a capillary, right? In order to bleed, you have to cut into capillary. But it might not bleed, but you see this kind of liquid that kind of oozes out. I know it's kind of gross, right? That liquid that oozes out, that's an interstitial fluid that I've been talking about. That surrounds all of our tissues. That fluid surrounds all of our blood vessels. So take a look at the red blood cells as it goes through. By the way, we'll talk a little bit about sickle cell later on, but there's a reason why people with sickle cell anemia, they get into certain situations where they go into sickling crises. Here's why. When a red blood cell goes past in a capillary, the capillary is so small that the red blood cell must pass single file through the capillary and into the vein, right? Sometimes the capillary is so small that in order to move these red blood cells through, all right, you actually have to pinch the red blood cell down a little bit to squeeze it through, right? People with sickle cell anemia, the disease, they get the sickling crisis a lot. And what happens, right? People with sickle cell anemia, the actual plasma membrane of these red blood cells are a little mutated. And what happens is it causes the plasma membrane to be less pliable, harder to bend. Because they're hard to bend, because they're sickled, they get stuck in the capillary. As it gets stuck in the capillary, you can't push the blood through anymore, and you have a crisis occur, right? And now you have a functional blood clot occurring. That happens anywhere where you see capillaries, which is everywhere, right? So you could see people, right, almost having conditions like MIs, myocardial infarcts, like, right, strokes from sickling crises. The reason is not because you're having a blood clot causing a stroke, but you're having the red blood cells being stuck in the capillary because it can't bend, right? Because it can't bend, it gets stuck, and now you form a blood clot. So this is what the red blood cells look like at its thinnest. Look at how thin that is, right? And what happens? This is a capillary right here. You can imagine if there's any reason why the walls of the capillary, right, any reason at all why they even become, right, even smaller in diameter, well, it's, you know, if it's even smaller in diameter, so on the walls of the capillary right here, if it's smaller and shrinks, the red blood cells are going to have a hard time getting through, right? But they are thin enough that we can pinch the edges together. As we pinch the edges together, we can force them through, right? That narrow capillary, unless there's a problem, right? If there's a problem and we can't pinch it, now they'll get stuck. That's exactly what happens with sickling crises in people with, right, sickle cell anemia. Usually the good thing is it usually happens with people with the actual disease, but it can happen with people with the trait. And we'll talk more about that later on. So what is this hemoglobin we talk about? Hemoglobin is a all right, so here's all the chemistry of the heme, right? This, the important thing is understanding that there's iron in the middle. The whole chemical formula here, right? The whole chemical structure is to, right, cause solidification right here of the iron, to stabilize iron. As you stabilize the iron, iron will react with oxygen. That iron reacting with oxygen gives us a rusty color, a reddish color, right? That's why our red blood cells are red, is the effect of oxygen binding with the iron found in hemoglobin, right? Now, here's one molecule of hemoglobin. There's 4 amino acid protein chains called globins. There's 2 alphas, 2 betas. Within each of the globin amino acid chains right here, you have heme. So each hemoglobin molecule can carry 4 oxygens because it has 4 irons and 4 heme structures. Now, in a red blood cell, we're going to have billions of these hemoglobin molecules, right? You don't just have 1 hemoglobin molecule in each red blood cell. You're going to have billions of hemoglobin molecules per red blood cell. And now you have billions of red blood cells. That's a lot of oxygen we can carry. Lots of oxygen, enough for us to give to our cells to drive aerobic respiration and produce energy. Right? So review those in terms of the globin chain. Right? And the last thing I'll talk about right now is this, erythropoiesis. And it's kind of cool, right? I was born in Indonesia. I moved to America when I was 8 years old, right? Now, I wasn't just born in Indonesia, like in a big, city like Jakarta. I was born in a very, very small city, all right, in rural Indonesia. And why am I mentioning it? One of the first Americans I ever heard about was Muhammad Ali, right? I was born in the 70s, so Muhammad Ali was huge, right? Not just in America. Muhammad Ali is a Muslim. Indonesia is a Muslim country. So we would watch fights with Muhammad Ali ever since I was a child, right? So you can imagine, right? Why am I mentioning Muhammad Ali? Well, Muhammad Ali was one of the first to undergo what we call high altitude training, right? Now, everybody does it, right? They undergo high altitude training. Why? Well, here's this reason, right? Most of the training centers, if you watch MMA fighters, boxers, wrestlers, right? The US Wrestling Federation, their training site is in Colorado Springs, high altitude. What happens at high altitude? High altitude, less oxygen. Less oxygen, right, is this. When there's less oxygen, it's actually going to trigger the release of this hormone called EPO, erythropoietin. EPO is the most potent stimulator of your bone marrow to produce more red blood cells. In the process of producing more red blood cells, I have more oxygen carrying capacity. So whatever oxygen's in my atmosphere, I can absorb more of it because I have more red blood cell, right? Because I have more red blood cell, I can pick up whatever oxygen's available and I can increase my blood oxygen, right? Remember what I said about oxygen? That's fuel. So the more red blood cells, the more oxygen I carry in the red blood cell, the more fuel I can have. So let's think about what happens when people train at high altitude for months at a time. As you're training at high altitude, the higher the altitude, you guys have heard that the atmosphere is thinner, right, at high altitude, right? Now you ask, how is it thinner? Well, it's not really thinner. What I want you to think about is the higher the altitude, the less available gas, right? So normally at sea level, we have a certain amount of oxygen, right? I'll give you numbers, but it doesn't really matter right now, right? You have about 160 millimeters of mercury of oxygen at sea level, right? But the higher up we go in elevation, the less oxygen available there will be, right? There'll be less and less oxygen. So if you're training at sea level, that's a lot of oxygen. But what happens when you go to Colorado Springs and you're a mile and a half above sea level? Mile and a half above sea level, there's less oxygen in the atmosphere. What happens then? You're training with low oxygen. The kidneys then produces lots of EPO. The EPO then creates more red blood cells in the red bone marrow right here, which increases more red blood cells, right? And what happens? Now, even though there's less oxygen in the environment, I have more red blood cells readily available to soak up any oxygen we bring into lungs. It makes it easier for oxygen to kind of go through and bind to the red blood cells. And since we have more red blood cells, we have more oxygen carrying capacity. This allows us to form more red blood cells. Now, what happens then? If they're training at high altitude, they'll have more and more and more red blood cells. When they're fighting and they're boxing or they're having a match, they never have a match at high sea level. It's always at lower sea level, right? Why? Well, because of this. When they train, they form more red blood cells. And now, when they're fighting, they're wrestling, they're boxing, right? They're at normal sea level, where now there's a lot more oxygen, right? Normally, they were training, maybe it was a half of the oxygen available. Now they are fighting, and they're about to enter the match, right? Enter the ring, right? They have more red blood cells than normal. And now you have more oxygen than what you were used to as well. Now what happens? More oxygen, more red blood cells, more fuel. So then you can fight for longer. This is not cheating either, right? Why? Because we're using our body's own physiology to produce red blood cells. Using our own body's physiology then, when we actually fight at sea level, right? We're using our own body's physiology to give us more fuel. It's kind of cool. Now, everybody does it now, but I know Muhammad Ali was one of the first to do it in the 50s and 60s. So he's a groundbreaker in so many different ways. Any questions so far?
Well,